And I said, but have you ever been trained in how to repair an alliance rupture? We know they occur, big ones or small ones, in most sessions. Patients rarely report them, and yet it's very clear that the more ruptures you have in the alliance, the worse the therapy goes. So fortunately, the supervisor said, well, we read about that, but we haven't done it. And online, there's some great materials put out by Chris Moran, Catherine Eubanks, and the late Jeremy Safran. So I said, well, I've been to 3 or 4 of their training. We can do this in 2 hours. And the students loved it. The supervisors were giving me the stink eye the entire time.
John, this is exactly my experience. The students, look, I'm learning to do something. Teach me the skills I need.
And the students were like, let's do more. And I said, well, we have some other things to cover today. Yeah. And they said, well, how about one more example? And so there's hundreds of examples. As you know, there's sort of confrontation with ruptures, and then there's withdrawal ruptures. So we practiced it.